I'm Craig Hedberg, an epidemiologist and professor at the School of Public Health in the Division of Environmental Health Sciences. Antimicrobial resistance, has emerged as an important public health problem over the past couple decades. And the antimicrobial resistant bacteria are important because if people develop clinical infections, many of these may be more difficult to treat, and so there's more serious illnesses, hospitalization, and delayed recovery from illnesses. So there's an increasing burden of illness that are associated with these infections. As an epidemiologist, one of the things that's always been intriguing about particularly some of the multi-drug resistant strains of Salmonella is that they seem to be moving as sort of clonal organisms, and their spread is much more of the kind of spread that we see with the development of other pathogens, or we see outbreaks of disease. There's a lot of interest in sort of the use of antibiotics in clinical medicine and in agricultural production. And there's this model that we have that when you use antibiotics, the bacteria are exposed to these to the antibiotics, and then resistance develops. And that certainly is something that happens. But what we see with these multi-drug resistant pathogens isn't so much that they are developing in direct response to the antimicrobials, but they're really being transmitted in animal populations. And one of my concerns is that we really haven't addressed sort of the spread of these organisms in the way that we would conventional outbreaks of disease. Well, with antimicrobial resistance, generally, the use of antibiotics in clinical medicine is one of the potential drivers for the development of resistance. And so one of the issues with the general public is the more that, we seek antibiotics for the treatment of infections that may be viral in origin, the more we're putting pressure on the development of these bacteria in nature. And so one of the things that people can generally do is really be aware of this problem. And, when seeking treatment for respiratory illnesses that may be viral, to really not really push for getting antibiotics as the answer for every problem. The other issue that has been important from a food system standpoint is that as people have looked at the use of antibiotics in agricultural production systems, consumers have had a huge impact on the behavior of big food companies. Big food companies responding to public concern about the use of antibiotics have really started to change their practices so that they could promote a responsible position for the public. So big food companies, restaurant chains, grocery stores have really led some of the changing practices at the production level because of public concerns about the use of antibiotics in agriculture. So I think one of the gaps we have is actually in understanding sort of the balance of how these strains emerge, both from the standpoint of how the individual bacteria accumulate the resistance genes, and then how these bacteria are disseminated throughout our food systems. And so one of the areas where I think there's really some increasing need for investment is just in better surveillance of bacteria in our food animal populations, and a better way of tracking the movements of these organisms around the globe. When we look at sort of practices that may go on at the farm level, multi-drug resistant strains of bacteria are probably not being generated on every farm. However, what happens at the farm level may make it more or less likely that these emerging strains may get into the farm setting. And really understanding more of those dynamics, I think, is an important part of where we can go to build better, more resilient defensive systems to prevent the widespread movement of these organisms.